Hi friends, welcome to lesson 27, Approaches and Strategies for Social Development, Growth with Equity, Basic Needs and Quality of Life. Development is a form of change which indicates significant change in social living. Social development can be attained only by ensuring the satisfaction of basic needs, ensuring growth with equity, justice and improvement in quality of life. The objectives of this lesson are: you will be able to understand the concept of growth with equity, you will be able to understand the significance of minimum needs and quality of life. Let us begin with growth with equity. The World Bank describes equity as equal access to opportunities that allow people to pursue a life of their own choosing and to avoid extreme deprivations in outcomes. Equity is the active commitment to fairness, justice and equality in the formulation of public policy, distribution of public services, implementation of public policy and management of all institutions serving the public directly or by contract. Social development is possible only with growth and equity, which are also objectives of planning system in India. Growth refers to increase in national income over a long period of time. Equity refers to an equitable distribution of this income so that the benefits of higher economic growth can be passed on to all sections of population to bring about social justice. Growth is assessed by the market value of goods and services produced in economy, that is GDP. However, it does not ensure and it does not guarantee an equitable distribution of the income from this production. In other words, the major share of GDP might be owned by a small proportion of population, which may result in exploitation of weaker sections of society. Hence, growth with equity is a rational and desirable approach for social development. This strategy facilitates that the benefits of high growth are shared by all the people equally and hence inequality of income is reduced along with growth in the income. In the 1950s and 1960s, development was largely used in the context of economic development, gradually becoming the focus of the newly independent countries. During the period, economic growth became the key focus and the main goal of economic development. Development economists opine that economic growth is not a single aspect that can be used to economic development. Economic development cannot be confined only to a number of quantitative changes but should include qualitative changes as well. Hence, economic development during this period focused on quantitative aspects, ignoring the qualitative aspects that could not be quantified yet were very important to the development. The debate on the limitations of using economic growth as a yardstick for development led to the redefinition of economic development. In the 1970s, the concept of development was extended to include the idea of poverty alleviation. During this period, the reduction of poverty, inequality and unemployment became the main concentrate of economic development. However, development economists failed to provide appropriate answers to their undue emphasis on material aspects of development at the cost of social conditions of people's life. This was shown by the fact that even though real income dramatically rose in several countries during the period, the self-reported subjective well-being of their populations did not only fail to increase but in fact declined. This implied that only a growth perspective with focus on material conditions cannot lead to inclusive and equitable development. Hence, several development economists came to the conclusion that the real development was no longer viewed purely from physical and material aspects. Furthermore, the continuous exploitation of these physical and material resources coupled with environmental destruction and degradation in the course of their extraction have rendered them unsustainable. In the 1980s, the global trend on the concept of development shifted to sustainable development. Hence, sustainable development became one of the key points to redefine development with recognition of the environmental concerns. During the period, sustainable development emphasized three main components: social, economic and environmental. However, some critics have argued that sustainable development focused solely on economic and environmental components, ignoring the social component, which is very fundamental to development. In the 2000s, the global trend on the concept of development shifted to the Millennium Development Goals (MDGs) as new guidance for the world on development over the next 15 years. In this new concept, 8 goals were spelled out. These goals mainly focused on social development with equity. It was expected that by 2015, the MDGs would have attained these aspects. Firstly, eradicate extreme poverty and hunger. Secondly, achieve universal primary education. Thirdly, promote gender equality and empower women. Fourthly, reduce child mortality. Fifthly, improve maternal health. Sixthly, combat HIV/AIDS, malaria and other diseases. The seventh goal was to ensure environmental sustainability, and the eighth goal was to develop a global partnership for development. However, by 2015, much of these goals were not attained because the Millennium Development Goals focused on poverty alleviation, ignoring the other social goals that were not material and physical but were very important for development. Due to these limitations and weaknesses of MDGs, Sustainable Development Goals, that is SDGs, emerged as a new concept of development. It was intended to remedy the limitations and weaknesses in MDGs. The Sustainable Development Goals are a set of 17 goals and 169 targets presented as a new vision for the world after 2015 to be achieved by 2030. The 17 SDGs to transform our world are: Goal 1, no poverty; Goal 2, zero hunger; the third SDG is good health and well-being; Goal 4 is quality education; Goal 5 is gender equality; Goal 6 is clean water and sanitation; Goal 7 is affordable and clean energy; Goal 8, decent work and economic growth; Goal 9, industry, innovation and infrastructure. Goal 10, reduced inequality. Goal 11, sustainable cities and communities. Goal 12, responsible consumption and production. Goal 13, climate action. Goal 14, life below water. Goal 15, life on land. Goal 16, peace and justice, strong institutions. And goal 17, partnerships to achieve the goal. SDGs mainly focus on three components: economic, environment and social. The introduction of SDGs was not only instrumental in overcoming the shortcomings of MDGs, but also provided a new direction for social development that was largely overlooked by the previous literature in the areas of development. There is increasing disconnect between economic growth and social development. As per popular development economist Jean Drèze, India's high economic growth has failed to bring about any significant improvement in the quality of life of the common people. Though it is necessary to generate wealth in the first place to redistribute it, however, overemphasis on high growth rate may create huge inequality and disparity. Overemphasis on GDP growth ignores account of inequality. India needs alternative metrics to complement GDP in order to get a more comprehensive view of development and ensure informed policy making that does not exclusively prioritize economic growth. Thus, it is important to emphasize that economic growth coupled with equity can facilitate socio-economic development. Equity gets impacted due to social exclusion of groups and communities. Social exclusion occurs where there is child abuse and neglect, educational failure and illiteracy, poverty, involuntary unemployment, marginal and insecure employment, sickness and ill health. There are barriers to participation for people with disabilities, criminal victimization, social isolation, alienation from political participation and discrimination. Social exclusion defeats the objective of equity even if economic growth is taking place. This also inhibits people and communities from effectively participating in development. In most of the literature on development, the common dimensions of social development framework are employment, education, health, justice, poverty, freedom, equity, gender, inequality and access to basic infrastructure and services. Let us now understand the concept of basic needs and its role in social development. Basic needs thinking reached prominence in late 1970s when it became a central organizing principle for development work in the International Labour Organization ILO and began to be a focus for some work within the World Bank. This reflected growing concern that the benefits of economic growth in developing countries had not trickled down to the poor in the way that liberal economic theory had predicted. It was a response to the evidence that structural adjustment policies in countries with severe economic crisis were having a devastating impact on the poor. UNICEF's approach of adjustment with the human face encouraged the targeting of scarce state support to the poor and vulnerable and shifting public spending towards the basic needs provision. By the mid-1980s, basic needs were being forced off the agenda by growing neoliberal perspectives that saw efficient markets as the key mechanisms for satisfying needs. However, basic needs thinking about well-being remains very influential and has experienced something of a comeback. The World Summit on Social Development at Copenhagen in 1995 and the MDGs both make extensive use of basic needs thinking about well-being, and this is reflected in the latter's focus on survival, health, hunger, safe water and basic education. A basic needs approach to development is one which gives priority to meeting the basic minimum needs of all the people. Basic needs are inclusive of fulfillment of certain standards of nutrition, including food and water, shelter, clothing, provision of health and education services. Factors like employment, participation and political liberty also are part of it. Development should be concerned with removing absolute deprivation as a first priority. Ensuring basic needs requires appropriate measures and political will. The objective of a basic needs approach to development is to provide opportunities for the full physical, mental and social development of the individual. This approach focuses on mobilizing particular resources for particular groups identified as deficient in these resources and concentrates on the nature of what is provided rather than on income. It is therefore a more positive and concrete concept. Social development is not possible unless the needs of the people are satisfied. This satisfaction can be achieved only with economic prosperity, social equality and justice. The concept of social development thus is an amalgam of the social, economic, cultural resurgence of a society. Equity should aim at achieving social goals which are common to individuals and societies. These relate to fundamental human needs that are present in all societies and all cultures at all times. All people have certain basic needs without which life cannot be sustained. These life-sustaining basic human needs include shelter, health and protection. In absence of these needs or acute shortage may lead to stage of underdevelopment. Economic development is necessary condition for the improvement in the quality of life. This also contributes in social development and realization of human potential. The rising per capita incomes, the elimination of absolute poverty, greater employment opportunities and income inequalities therefore constitute the necessary but not sufficient conditions for development. Sense of self-esteem at social level, which is significant for identity, dignity, respect, honor and recognition. The nature and form of this self-esteem may vary from society to society and from one culture to another. Development is legitimized as an indisputable measure of gaining self-esteem. Another strategy of social development through basic needs approach is to have freedom to make a choice. The idea that freedom of choice is quite central to leading a good life is not a new one. Aristotle also has discussed about this in his writings. Given the importance of quality of life of the members of the society in judging the success of economic policies, it is easy to see the centrality of freedom of choice to economic evaluation and assessment. It is, in a sense, more important than wealth, with which so much of economics as a separate discipline is concerned. The life of money making, as Aristotle noted, is one undertaken under compulsion, and wealth is evidently not the good we are seeking, for it is merely useful and for the sake of something else. Freedom in this context implies emancipation from ignorance, misery, subordination, institution, and rigid beliefs. Social development through fulfillment of basic needs is inclusive of political freedom, including personal security, the role of law, freedom of expression, political participation, and equality of opportunity. The fulfillment of basic needs for social development is combination of social, economic, and institutional processes for a better life. The growth strategy focused mostly on economic aspects of development and ignoring the other dimensions of development. The basic needs approach was advanced with the basic aim to relieve as quickly as possible absolute poverty through intensive direct assistance to those in desperate circumstances. Another goal was to meet the basic needs of the entire population, such as food, clothing, shelter, education, human rights, etc. This has to be coupled with participation in social life through employment and political involvement. However, the basic needs did not imply less significance to GNP. To implement and execute every aspect of basic needs, capital is required. Development can be attained and is sustainable only if the basic needs are fulfilled. Though the idea of development began with the dominant ideology of economic growth, but development fails if the benefits of growth does not reach at grassroots levels. Even the viewpoint of United Nations with regard to development is a unified approach which leaves no section of population outside the scope of change and development. Social development is thus characterized by two dominant simultaneous factors like economic requirements and socio-political necessities. The social goal of development is social equity, meaning thereby an equitable distribution of income and opportunities. The strategies of social development seek to initiate a process of maintaining equilibrium between growth, equity, and meeting the needs of the people and ensuring good quality of life. This can be achieved by capacity building, social change, and distributive justice through maintenance and reinforcement of existing relevant system and establishment of new counter system. Let us now discuss about quality of life. Quality of life is also an important component of social development. Quality of life may be defined as subjective well-being. The best way of approaching quality of life measurement is to measure the extent to which people's happiness requirements are met, that is, those requirements which are a necessary although not sufficient condition of anyone's happiness, those without which no member of the human race can be happy. Quality of life reflects the difference, the gap between the hopes and expectations of a person and their present experience. Human adaptation is such that life expectations are usually adjusted so as to lie within the realm of what the individual perceives to be possible. This enables people who have difficult life circumstances to maintain a reasonable quality of life. In quality of life research, one often distinguishes between the subjective and objective quality of life. Subjective quality of life is about feeling good and being satisfied with things in general. Objective quality of life is about fulfilling the societal and cultural demands for material wealth, social status and physical well-being. Quality of life is also about the degree to which a person enjoys the important possibilities of his or her life. Possibilities result from opportunities and limitations each person has in his or her life and reflect the interaction of personal and environmental factors. According to Quality of Life Research Unit, University of Toronto, there are three major life domains of quality of life: being, belonging and becoming. The conceptualization of being, belonging and becoming as the domains of quality of life were developed from the insights of various writers. The being domain includes the basic aspects of who one is and has three subdomains: physical, psychological and spiritual. Physical being includes aspects of physical health, personal hygiene, nutrition, exercise, grooming, clothing and physical appearance. Psychological being includes the person's psychological health and adjustment, cognitions, feelings and evaluations concerning the self and self-control. Spiritual being reflects personal values, personal standards of conduct and spiritual beliefs which may or may not be associated with organized religions. Belonging includes the person's fit with his or her environments and also has three subdomains: physical, social and community. The physical belonging is defined as the connections the person has with his or her physical environment such as home, workplace, neighborhood, school and community. Social belonging includes links with social environment and includes the sense of acceptance by the intimate others like family, friends, co-workers and neighborhood and community. Community belonging represents access to resources normally available to community members such as adequate income, health and social services, employment, educational and recreational programs and community activities. Becoming refers to the purposeful activities carried out to achieve personal goals, hopes and wishes. The three dimensions are practical, leisure and growth. Practical becoming describes day-to-day actions such as domestic activities, paid work, school or volunteer activities and seeing to health or social needs. Leisure becoming includes activities that promote relaxation and stress reduction. These include games, neighborhood walks and family visits or longer duration activities such as vacations or holidays. growth becoming activities promote the improvement or maintenance of knowledge and skills. The approach to the measurement of the quality of life derives from the position that there are a number of domains of living. Each domain contributes to one's overall assessment of the quality of life. The domains include family and friends, work, neighborhood, shelter, community, health, education, and the spiritual aspects. UNDP, United Nations Development Programme, has been publishing the Annual Human Development Index HDI for countries around the world. It examines the health, education and wealth of each nation's citizens by measuring life expectancy, educational achievement both at adult literacy plus combined primary, secondary and tertiary enrollment, and the standard of living in terms of real GDP per capita based on PPP, which is Purchasing Power Parity Exchange Rates. These are also essential components of quality of life. According to Ramakrishna Mukherjee, there are essentially two perspectives taken in quality of life research. Social indicators research, which considers the elite's valuation of what the people need, and the conventional quality of life research, which studies what people want in order to improve their quality of life. The purpose of Quality of Life Index QOLI is to provide a tool for community development which can be used to monitor key indicators that encompass the social, health, environmental and economic dimensions of quality of life in the community. The QOLI can be used to comment frequently on key issues that affect people and contribute to the public debate about how to improve the quality of life in the community. It is intended to monitor conditions which affect the living and working conditions of people and focus community action on ways to improve health. Quality of life is the product of interplay among social, health, economic, environmental conditions which affect human and social development. According to Dschiyyrs, the questions to ask about a country's development are three. What are they? Firstly, what has been happening to poverty? Secondly, what has been happening to unemployment? And thirdly, what has been happening to inequality? If all three of these have declined from high levels, then beyond doubt this has been a period of development for the country concerned. These three things are considered the central challenges that nations battle with and try to combat, or at least try to minimize. To Dschiyyrs, all these three must be at low levels before we can declare that a society has developed. This invariably means that a rise in any one of these central challenges disqualifies that society from being called socially developed. Development cannot be assessed only on the basis of expansion of material wealth or economic growth. Development also means a succession of deep social changes which should inevitably accompany the technological transformations. The concept of development is not merely quantitative, it includes qualitative features of the human groups touched by it. To grow is one thing and to develop is quite another. In more general terms, growth is easier. To develop in a balanced way is much harder. This can be addressed by including equity as an element and simultaneously making endeavors for it. Let us sum up this lesson, friends. Development is the capacity of a state to increase its human resource with the aim of achieving higher outcome of production for the satisfaction of the basic needs of majority of its citizens and empowering them to make demands on the government. Thus, the core strategy of development is to address both quantitative and qualitative aspects. Inclusive social development, society's total development, well-being of the people, social transformation and improving people's quality of life and other features are equally important than the social development. Social development constitutes equitable distribution of resource, elimination of inequalities, the capacity of people to work continuously for societal welfare and the process of structural changes. Thank you.